Let me say, yes, Quail, good day. People have had an opportunity to get to know a little bit more about myself. Really, I think this was an opportunity to further conversations around how we might, I think, work collectively, or what interests or opportunities we might see with regards to supporting Indigenous sovereignty in our areas of work. So yeah, I mean, I didn't really want to spend too much more time talking myself, because I have done a lot of that so far today. But we're just wondering if people here around the room felt so inclined to put on their speaker and introduce themselves, or take the opportunity to do so in the chat screen. And for some of those who might have joined a bit later, I'll just say a little bit more about, or I'll just say a little bit about myself. So my name's Shannon Waters. I'm a public health and preventative medicine physician. I'm also what's called a medical health officer within Island Health with the Cowichan Valley region. And I am mixed blood, Coast Salish on my mother's side from Stamanis First Nation, which is within the territory that I'm working within, and I'm Swedish, Hungarian, and Scottish on my father's side. I have my career physician of the importance of our relationships to environment, to all the living beings that we interact with, and to especially having worked at certain parts of my career in Indigenous health, to how the way we view and interact with the world is critical and fundamental to Indigenous health, and ultimately to the health of us all. So that is part of what brings me in a very excited way to the work that I do every day, though sometimes I will also say it feels very daunting. I'd only just heard about the Cascade Institute, and it was really interesting to hear that and some of the really innovative work that's happening there. And I also feel that you know, our Indigenous approaches, well, certainly not, I think in many cases, new, are long-standing and also very innovative ways to look at something further. Now I'm again. Okay, sorry guys. How are other people hearing me? All right. I'm on the same computer I was this morning. So maybe with that, since people can't hear me, if anyone has any questions or anything that came up from this morning, or other questions, please do speak up or put it in the chat, and I will try and remedy my audio issue here.
Shannon, do you happen to have a headset? That'll help you, help the sound.
No, I do not have a headset. Sure, someone is going to go try and find me a headset. Thanks. I feel like I should just type instead of speaking, guys. I don't know what it is about this today.
You might also want to try just turning off your video, just having audio. It might be clearer that way.
All right, does that help at all?
Yeah.
Okay, great. So yeah, I was just giving a little bit of a background on myself, and I would be really interested, whoever might be willing to share a little bit about themselves and what maybe in their work or their own personal background makes you particularly interested in this topic of Indigenous sovereignty and sustainability, and how you might have already seen it working, or why you bring yourself to this conversation?
Well, I might jump in. I'm Suzanne Gaby, and I work with the Inuit up in Nunavut, and I've been doing it for the last 5 years. And it's we struggle as Southerners going up to Nunavut and helping out, and I really see when the Inuit are totally involved in co-creating any of the projects and programs, where they're just far more successful. I know when we first started working up there, people were saying, oh, we want the programs like tobacco reduction, tobacco cessation. We want it to be connected to going out on the land and having country food. And I know that there was so much resistance from the government to give money towards going out on the land and country food. And yet now we're seeing more and more of the like the substance use programming actually involved in taking people out on the land for 2 weeks and having treatment. And they are being, we're seeing success. So to me, part of that is, really being, I think someone said it today, we have to unlearn some of the things that we've done in public health, things that we think we know, and be very humble and go in with humility and not think that we know it all. And so, yeah, I'm really interested in seeing more programming happening with Indigenous people, Inuit people, involved in things right from the very beginning, right through to the end when we're evaluating and sharing what we learned with them, not just, keeping it on a shelf for, like with the Inuit, knowledge is to be shared. And and we don't do it very well, I think. Anyways, that's my thoughts.
Thanks, Suzanne. I think Ash, were you going to say something?
Yeah, I just wanted to take the opportunity to introduce myself. My name is Ashlani. I used to work at the BC Centre for Disease Control in harm reduction and work closely with First Nations Health Authority in that regard. I'm now my partner and I started a public affairs firm where we work with clients in public health, and my partner is Métis. And one of the things that we work with both Indigenous clients and with clients in government. And I think one of the things that I would love to hear your perspective on, Dr. Waters, is around how I think you commented on earlier about how the Indigenous ways of being are really circular in many ways, and everything is connected. Whereas I think in government, often we take a very linear approach to things, and the timeline is quite different of like, this needs to happen in a 6-month window and it needs to happen in this prescribed process. But really Indigenous ways of being are really different, and that tension exists when people try to work together. So perhaps you can comment on how in your own work and in the communities that obviously you have a wealth of experience, and I wonder if you could share something for those of us who are just starting in this area.
Yeah, no, thanks, Ash, for that question. It's a really good one. And yeah, so I've been working in population and public health, I guess it's 12 years now. And there's been huge changes that have happened during that time. So I used to work at First Nations Inuit Health Branch, which was part of the federal government. And then I was there when there was the transition to the First Nations Health Authority. And so I worked there. And yeah, that was such a momentous time. And I really speak to sometimes how I shared a depiction of the First Nations perspective on health and wellness, I think in the plenary, and you don't have an is like at the top, and there's people holding hands around the outside, and at the top there's a child, there's a small person, and I was presenting one time, and I had my daughter with me. I have 2 daughters, so my I only had one daughter at that point. She was 4 at the time, and she said to me, "Mom, where's your picture with me in it?" I was like, "What is she talking about?" And then she saw the particular slide, and she's like, "Mom, there's me." And she pointed at the top, and then she said, "There's you and Daddy on either side holding my hands." And I was I was like struck. I'm like, like our children are so much our teachers. And I was like, oh my gosh, this is it. Like my daughter now sees herself and how we're building our health systems. And I don't think I could have shown her any framework previously where she actually like sees herself and is looking for herself and asking me to show her where she is. And so I guess bringing that up, some of this is generational. Like my children and children around now will not remember a world where there wasn't a First Nations health authority if they're here in BC, that depicts them in a more fulsome way. And there was a lot of timelines and pressures and quite frankly, naysaying on the federal government's behalf that you would never get over 200 First Nations in BC to agree to make a shift like that. But we did it. It wasn't a perfect process. Nothing is perfect. But it also involved a lot of hearts and minds coming together and being invested. So I think sometimes even just talking about timelines, I think it's about time is important, but also the energy. If you have a lot of people putting a lot of energy into something, like timelines shrink or contract. And I think Tad talking about like the amount of change that has happened very quickly with COVID, because we all collectively had so much energy looking at this level and a lot of emotion that were involved in, changes that happened. And so I think, I spoke earlier in the watershed session about some of the opportunities we have with the DRIP Act right now here in BC. And a colleague and myself are looking at the Drinking Water Protection Act and how we can align that to the DRIP Act, which basically means blowing it up, because Drinking Water Protection Act is only considering water in terms of its utility to humans, not its utility to plants, animals, all beings that we, live with. And so really, I think there's probably a set timeline the government has wanted to put forward for this legislative review. And, it's going to need to have to expand. And it's going to need to have a lot of energy. And if people feel that the energy they're putting in will make a difference, you can have all that energy combined and have things happen in a bit of a different time frame. But some of this is also going to be generational at the same time. So I think allowing those places and spaces for both of those things to occur at one time, things very quickly and things that take a generation to commingle. And generational change sounds, I think, scary to the government in some cases, and it sounds scary when we're thinking about what we have in front of us in terms of the crisis with our environment. And we do need to make change quickly. So allowing that to happen simultaneously and not being afraid to let short time frames keep good work from happening. Because basically, if there's not the energy and the good hearts and the trust that is involved in the process, you can meet a short time frame with something that's never going to achieve what you had hoped it might anyway. So I think, it sounds very interesting what you're doing. And I think as much as we can support each other when we need to expand those timelines as colleagues, I think is important. And as much as we can support each other in bringing our energies together to try and make things happen quickly when it seems like that is needed, I think helps as well. Yeah, Lori?
Hi, Shannon. Thank you so much for your your great presentation this morning. And I just wanted to say a couple of things. I think one of the things that I think is really coming to the forefront is the long cultural history of Indigenous people, First Nations people, on interconnectedness, and that now, you know, of course, society is slowly realizing that very importance of that. So the interconnectedness of all of us and with nature, etc., is so important to the issues that we're facing. All of the issues. But the other thing I also wanted to raise out is another important cultural aspect of First Nations people is what you were just talking about, that taking the long view and thinking about, for instance, 7 generations, etc. And when you think about our system of government in all around the world, for instance, that we have politicians, for instance, that are elected for 4 years, and so that they're only thinking of their 4-year time span. And even like when I used to work for Vancouver Coastal Health, for instance, and there was a provincial project, a big project. But again, it was very, like, it had to be done within 2 years. Like, transformational change takes longer, as we know, but there was relationships that had to be built and things like that. But all of the people in the government, they want, you know, they're thinking in terms of 2 to 3 years instead of thinking of the long term. But it's our system that's designed this way. So anyway, when you were talking about this just now, it just made me think about that as well. So thank you, and I'll just leave it at that.
Yeah, thanks for that, Lori. I mean, one thing that what you bring up makes me think about is, you know, that our ways of being in relationships with our home territories, when you're talking about government timelines of 2 to 4 years, and, you know, governments changing and different mandates, you know, really a lot of this is about relationship, and relationships strengthen with time. They strengthen with, you know, good times and bad times. And that, I think that's one of the strengths that really needs to be looked at when we're looking at how we adjust our systems, and looking at from that, you know, kind of Western worldview to the Indigenous worldview is giving greater time for those relationships to develop. And yeah, I think a lot of the you know, Indian Act systems of government within a lot of communities put us on a different time frame. It put us on those time frames that, you know, don't really allow those relationships to strengthen and mature, where there's, like, you know, 2, 3, 4 year timelines. So we're really you know, battling on many fronts during this time, and that's where I just find it, you know, a real privilege and opportunity to be in the type of role that I'm in, where I very much speak with government partners in this role as a medical health officer, but I'm not in an elected position. You know, I'm you know, basically kind of appointed. It's a job, but, you know, I form relationships over time, but many of those turn over quite a bit, which you know, adds complexity to, you know, what we try to achieve together.
So I think I'm going to start screen sharing just to capture these notes so that people can see them.
One other thing I'll just make comments on is, but when Fleur is putting that up, is I'm just interested on anyone's thoughts, or if they've worked with story in their work at all, now, and Trevor's as well, and like often, you know, we're talking about how we want to capture people and to get their attention, and you know, fear is one way of doing it. Let me just say, Tad's graph where we went to like a straight line moving up definitely provoked some, I'm sure, emotion. Did for myself. I'm sure it might have for many others of you as well. And numerical data, quantitative data is a very powerful way to do that. I was the director of health surveillance, sounds very authoritarian, at the First Nations Inuit Health Branch, and at First Nations help improve health. And I really think we don't use qualitative data enough. Story, you know, really, I think that's, you know, not that there's maybe not heart in numbers for many people, but like, you know, bringing heart and whatever into some of the stories in terms of how we tell where we are with our health. And I think of many of the origin stories and what we have as Indigenous peoples, which give us meaning and direction in many cases for what we do, especially in times of difficulty. And so I think about the powerful combination of story and quantitative data, and just wondering if anyone had any examples or thoughts on that. Yeah.
Hi.
Hi again. I didn't see anybody else raise their hand, so I thought I'll just chime in, but don't want to hog it. But I'm an evaluator is one of the things I do, but I tend to use a lot more qualitative work in terms of telling stories and capturing perspectives from different stakeholders from a qualitative perspective. That's a lot more powerful a lot of times than just the numbers. So it's something that is just part of the way I do things. So I just want to throw that out there.
Thanks, Lauren. I'm trying to navigate some of the comments here as well. Yeah, qualitative data takes the person as a whole into account. Huge fan of capturing and relating stories. Do you think, I mean, one thing I often feel challenged with is you know, our systems, I think they create a hierarchy of data, basically, and yeah, that you know, numbers and stories, you know, get placed within that hierarchy. I remember one time when I was with the First Nations Health Authority, and I was speaking in the interior, and a very dear health director, I had given a presentation, and he came up to me and he was like, well, thank you, Dr. Waters, that was very, it's all just squiggly lines on paper to me. And yeah, now some of those squiggly lines are becoming straight up in the wrong direction, but I think it still adds, and I think you know, one of the things I've really noticed with Tad had mentioned Bonnie Henry, and so she's a close colleague of mine. I've worked with her in her office in the past, and you know, I just really feel, you know, when she speaks to us, you know, as a province, you know, she's unfolding a story, and even the, you know, the songs and the different things that are coming out with regards to this, I just really feel that, you know, that'll be part of our story of, you know, responding collectively to COVID in the province, which I think, I don't know, I mean, I have 2 kids, so I'm not watching the media all the time, but I just really feel like we have a connection to that, I think, in a different way here in BC than I've noticed in some other parts of the country and the world, looking at different media.
Hi, it's Bernadette. Can you hear me?
Yes.
I'm a health policy analyst with Chiefs of Ontario, but we have, I mean, more and more a number of communities are using land-based programming for mental health and addictions, both prevention and treatment, and they're hugely successful. And you really need the qualitative story in evaluating those kinds of programs. The numbers just won't capture what you need to capture. Also, we recently completed a project with youth, Photo Voice, project on life promotion, and I think again that's an area where the qualitative Indigenous approach, it's stories from our roots. So it really tells their story from their lens, from their community and from their lens. Not sure if I'm making sense. It's 5 o'clock here in Ontario, so it's been a long day. But I think it's really important that the government recognizes our stories and the importance of the connection with the land. There was earlier discussion around funding for land-based programming and food and feasting and that sort of thing. And I remember about 5 years ago, we had some real arguments with, at the time, FNIB, around funding prescription drug abuse programs that included a healing, a feast as part of the celebration. And they didn't want to fund the food that would be included at that feast or any of the expenses for that feast. And we really had to work at helping them understand the importance of that as part of the whole healing process. It's coming around, it's getting better, but we have a long way to go, I think, in that aspect.
Thanks for that. And yeah, I just want to acknowledge you all the way over in Ontario and the time frame that you're in. And yeah, just very appreciate you being part of the discussion.
It's really an interesting program.
I see Ash. I'm not sure if there was anyone else, but Ash, I can see you.
Yeah, if anybody else wants to go ahead, I don't want to hog the mic, but I did have another follow-up question. So around the storytelling piece, like I think often when we engage communities too in public health or in government, we have a tendency to go ask for information when we need it, and then we turn around and kind of walk away and do our own thing with it. And I think there's a big component around, Dr. Waters, you mentioned earlier around, common energy and working together. And in that spirit, I wondered if you could perhaps comment on how you've seen storytelling be this, provide this space for this common engagement and putting common energy together, because I do think it's really critical that communities are fully involved in whatever is being planned to support community well-being.
One example I can think of off the top of my head is, so there's the regional health survey, and you might be familiar with this as well, Ash, hearing some of your previous work. But so there was the regional health in First Nations communities on reserve. And there is a specific survey that goes for youth and adults. And so there'll be reports that were put together with graphs or what have you. And one particular year, what ended up happening with the youth survey is they created with a video, and it was interesting because it spoke to some of the data that was found, and it was definitely a way that the youth, that age cohort, who that we more often look at the type of material, but it became something about them that they, you know, was cool and they could sing, and it was talked about because it became something that they owned and they sang when they were you know, together. And it just really made me think about what we used song for as peoples over time as well. And that, you know, voices can come together. You sing when you're celebrating, you sing when you're going through hard times. You sing, and you know, the Ballad of Bonnie Henry is one thing that was going on within, you know, BC. And so that's, and it is a way of telling story that becomes much more memorable. Like when it's a song, you can remember under, and I don't know, but I wonder if some of those youth, you know, 20 years from now, if they met, you know, after not seeing each other for a while, if some of them might, you know, remember that song and sing it. And so it just makes me think of how we, you know, collect, internalize, communicate about our time, about our health, about what we want to support. So, you know, I did see recently that the most recent report for the DRIP Act, the Declaration on the Rights of Indigenous Peoples Act for 2020, was just released, and I didn't even know it was released, so I took a look at it. And you know, I've been really thinking about like what are ways of you know, the DRIP Act coming to be here in BC, and where we're at with all the other work that's happened around the same time, and how do we get that out there in a way that people you know, memorize and talk about? Because when that story is shared beyond, it gains more power, it gains more ability to affect more people, and you know, then it takes on you know, that have changed over time, but still, you know, have teachings that are relevant to many people.
Hi, this is Fleur. I'm typing, but I thought I might jump in too, just to tell people a little bit about some of the work that I've been doing with people across the country. So the Canadian Institutes of Health Research recently funded 9 Indigenous health networks across the country. So there's one in the Atlantic, and there's, I think, 2 in the north, and then the rest are spread, like there's pretty well one in every province. So there's 9. So so we house the Saskatchewan network, but there's also a coordinating center that we house as well. So these only officially launched in April, so you might not have heard about them yet. They had been funded previously, and then there was kind of a lag in funding. But I'm just thinking that there's probably lots of projects that you might want to connect with your network in your region about. So, and I was going to pop in the chat a link to our website for the NEAR National Coordinating Center, but unfortunately our website's down right now because they're doing some maintenance on it. So, but I can put my email address in and people can contact me, and I can certainly send something out from there. Let me see here.
Thanks, Fleur. Are you trying to bring that up on the website? Is that what you're trying to do?
We have a website for this NEAR, like Network Environments for Indigenous Health Research National Coordinating Center, but our site is, they're doing some maintenance on it now, so I can't link to it because it would just go to
okay.
dead.
Great, and thanks, Fleur. And I don't know, you might have said it there, but you're in.
I'm in Saskatchewan.
Yeah. Yeah, and thanks for your assistance in note taking, and also for joining from Saskatchewan as well. Yeah, happy to hear what anyone else might have to say here. And I'm just, sorry, trying to read some of these comments here as well at the same time, and no, I'm not getting to them all, but I thought I recognize the name, and I'm gonna say, sorry for how I pronounce it, but Paulo Kioka. I do remember that name. So now when you say you're an environmental health officer with FNHA, I know why I do. So thanks for mentioning that. And it's people here working with qualitative experience of queer youth navigating overlapping public health crises. So tainted drug supply and COVID-19. A lot of learning that needs to be done around fostering basic competency when it comes to working with queer and two-spirit Indigenous youth. So that was from Rodney. And yeah, so just really wondering, I don't know if I can't see everyone on the screen here. So if anyone wants to speak, please do or maybe has Bernadette got her hand up? Is that what I'm seeing, Bernadette?
Shannon, can you hear me?
Yes, I can.
Okay. I'm Eric Wong. I'm with the First Nations School Association, and we run a program, a grant program, a school-based grant program for schools, First Nation schools, to fund programs in which students learn about making healthy food choices, and also secondly to increase daily physical activity. But going back to some of the points made by I think Ash, Lori, Bernadette, and a few others about the systemic barriers, about altering or changing evaluation tools. If there is anyone out there who actually are funders, represent funding organizations, I think the challenge for you is to think of or go outside the box to allow for other means of evaluation other than the sort of traditional data collection. When we started our program, as an example, organizations wanted us to collect data, and it was hard data. Things like, for example, pre-post measurement of BMI, or they wanted to do Likert surveys, monkey surveys, to indicate that students or young people are drinking more water after the intervention of the program. Instead, what we did was we developed an evaluation tool. We asked basically two questions. We asked, to the schools, we ask, do you have any stories that talk about the overall impact of the Circle of Wellbeing project? The second question is, were there any unintended impacts and outcomes, negative or positive, coming from the Circle of Wellbeing project? So using those two questions, I'll go back. The first question about stories. We had one school to enhance physical activity. They purchased shovels, and I had to admit, I was not clear what shovels would be used for. And this school was on Haidagway, and the school was going to take shovels, bring elders along, and basically teach the kids a traditional task that was somewhat lost, and that was clamming. So that was their physical activity, and that's their story. The second one about unintended outcomes. One school, we gave money to develop a breakfast program. And one of the unintended outcomes from that was there was an older student in grade 9, so 15 years of age, and one could describe this student as being a reluctant participant. But within the program, she took on a leadership role to work with the younger kids, to prepare the meals, to make sure that they're eating properly, etc. And I guess what I'm getting at is that if the funding groups or the funders could be more broad in how they will accept evaluation, because our concern, of course, is that if we submit this as our evaluation tool of data, will we be getting funding for the next year? That's the big question. Will we be able to match their criteria to what evaluation means to them? So that's a challenge. That's a challenge for the funding groups.
Thanks for that, Eric. Yeah, I have come across scenarios very similar to what you describe, and I think I think I mean, I'm going to say some of it, I think, likens back to, you know, which dominant worldview you're coming from, and therefore what you value in how you're evaluating it in the first place. And that you're evaluating it from a very, you know, quote unquote, Western perspective. And so that sets, you know, that perspective is so often what directs funding. It is what directs funding, and it affects decision making. And that's the perspective that our legislation comes from. Like at the senior, you know, higher, well, I mean, that even that's hierarchical, senior or higher, but where the decision making happens, it is almost usually entirely from non-Indigenous worldviews. I mentioned this morning that I am on the Cowichan Watershed Board, and we have the I guess, what's the word? We're fortunate in the Cowichan Valley that we have a large lake called Lake Cowichan, which can be a reservoir for the Cowichan River to help hold water when we have our rain, so that in the summers we can keep the river flows at levels which allow salmon to still swim. And that is, you know, an important thing, because we're people of the river. We're connected to the salmon. Like, the health of the river is our health. And we're looking to raise the weir, and basically that requires a new license with the province, and there was all these discussions that were happening. And someone from the province came and chatted to us as a watershed board to say, like, to list out the different considerations that needed to be taken in terms of raising the weir, and whose rights might be infringed on if the water rose. And so one of the primary things from a Western perspective was, if the water rose, people who owned property around the lake would lose some of their physical land on their property. And like that is significant. But within a Western paradigm, like, that was placed kind of really above and beyond many of the arguments that we were bringing forward, including like what this means to fish, what does it mean to the salmon, what does it mean to the plants around the area. And that, I think this, you know, that interspecies equity that had been mentioned earlier as well, you know, it's not just a human land, quote unquote, owner, it's, you know, everyone else. So when this individual was going through the process that they had and talked about, you know, they do consultation with Indigenous groups, and then they get to the decision-making table. I asked, oh, so who is at that decision-making table from an Indigenous perspective? And the individual said, oh, well, we do consultation with Indigenous groups, and then that comes to the decision-making table. And I said, well, no, that's not what I was asking, you know, because is everyone on that decision-making table from the one perspective? And you know, he thought about it for a second, and I think still wasn't completely getting what I was saying, but then he said yes. So I think that's where we have to really work to bring those other world perspectives, because that's where, you know, decisions around funding are being made without the value and the bringing forth at the decision-making tables. And that's where I feel the DRIP Act is a real opportunity right now, because it's going to basically legislate that Indigenous perspectives need to be incorporated, our rights need to be incorporated into all our legislation, which I think will force some of that to happen at decision-making tables. Or if, as we know, it might not, then we can at least refute that if it hasn't respected those ways of being, ways of seeing the world. I see someone's question here, is DRIP Act just in BC? Yes, it is. BC is the first region, territory, province within Canada that has put such legislation in place.
So we only have 3.5 minutes left, and we have to pick our top 3 to 5 points and have someone volunteer to present them. So we got to work fast.
All right. So, well, I think I heard quite a bit about story, that people were bringing that through. So I think highlighting, Fleur, if you can, some of the comments we made around that.
Yeah, and I think also stories like in an evaluation as well, maybe like collecting qualitative data. I'll make this a little bit nicer when I put it on the slides.
I think we also spent quite a bit of time talking about timelines, whose timeline, perspective of time.
And yeah, just looking here. And I think maybe it wasn't said specifically this way, but you know, maybe a bit of summarizing that, you know, just legitimizing multiple worldviews, not creating a hierarchy. Yeah. Anyone else? Any other thoughts you felt were highlights of this conversation that really should be brought forward?
I don't know that you quite got to it, Shannon, but I feel like you were almost almost there when you were talking about decision-making tables, because I think sometimes what happens at those tables too is they have one person from one territory and they're supposed to represent all Indigenous people, like for the whole country or all perspectives, which is like just unrealistic and way too much burden to put on any one individual. So you need multiple people, like they are representing, you know, multiple worldviews, I think.
Yeah. So to have Indigenous perspectives necessary at decision-making tables, and that DRIP Act is a big what's the word? A big you know, boon in that basically needing to take place. Now, some people have said, Fleur, that maybe you could be the person to present when we get back together with the group.
I don't mind doing it. I'm not technically supposed to, but I'm happy to.
Is there anyone else who would be interested? All right, well.
I get kicked out in 57 seconds, so.
So with that, I just would like to say.
Yeah, it looks like Lori had do you have a question, comment?
No.
Or are you volunteering?
No.
So yeah, I just want to say thank you everyone for joining the session and sharing your thoughts. And I didn't get to read through everything, but I think I'll be able to afterwards. And yeah, nice to meet some faces or voices I heard from before and some new ones as well. So Heichka. And this way of meeting, make sure everyone's in the plenary room all at the same time. It's very time efficient.
Thanks, Shannon.
Thanks, Fleur.